If you are pregnant, it's not uncommon that you might suffer from some aches and pains in your back. There's a lot going on with your body and it's really changing. But there are things you can do to help manage that discomfort. My name is Dr. Robin Armstrong. I'm a chiropractor at Willowbrook Chiropractic in Langley. And today I'm going to show you some exercises to help manage your back pain during pregnancy. Now you might want to watch my other video which has some tips and tricks and explanations about why you're suffering from back pain during pregnancy. Now, one of the changes that happens is an increase in our low back curve, our lordosis. So we start to curve more, which causes compression at the bottom of our low back. This is because of the growing baby, so it pulls our center of gravity forward. So there are a few things that you can do. You can practice some tucks of the pelvis, dropping the tailbone under, and then reversing it, tilting. So going back and forth, tucking the tailbone down, and then tilting back and forth. So if you're having to stand for a long time at the end of the day, you might be feeling that ache there, doing a few tilts and tucks can give a little bit of relief. The other thing you can do is just open up the front of the hip flexors. When our low back curves, we shorten the front of our thigh. So we can do a lunge to reverse that. So we're going to step one foot back behind us, tuck the tailbone down again, so slightly bending the back knee, and then push into the front knee. You can rise up with the spine and you should feel a little bit of an opening through the front of the thigh. If you want, you can add the arms overhead too to increase that sensation of a stretch through the front. Do that on both sides, at least 30 seconds at a time. The other change that starts to happen is the rounding of our shoulders. So this can be a response to this lower back curve, and then we kind of round to compensate for it, or it can be, changes in the growing size of our chest. So some things you can do are from a seated or a standing position. You can just take your arms out in front of you and you can squeeze your shoulder blades together and then draw your elbows backward. So we're opening the chest and we're engaging the muscles of the back. And then you can repeat that. Squeeze, trying to make the movement happen with the back. If you want, you can use a resistance band or some light weights and repeat this. So just rowing. So you want to do this 5 to 10 times and just feel a bit of that postural relief. Another thing you can do is a bit of a twist. So similar posture, we start with the arms out in front of us. We're going to draw a bow and arrow, pulling one elbow back and then extending the arm back behind us. So we're doing a slight twist open through the middle back, but nothing too dramatic. Come back through center and just pulling that bow, opening the arms. We're getting a stretch through the chest, engaging the muscles of the back, and then release. Do both sides, making sure you get that movement on both sides of the body. Pregnancy is an exciting time, but you can have a lot of different changes that can affect your back. So one of them is sciatica. So that's when you get a numbness or a tingling or maybe just a pain in your butt or down the back of the thigh. So one thing you can do for that is called sciatic nerve flossing. So you're going to sit, you're going to tuck the affected toe underneath you, and then look up. Okay, so if you're imagining that piece of floss, our nerve is at the back and it's kind of loose. And then we're going to make it tight in a C shape. So we're going to tuck the chin, extend the leg, look at the toes, and then bring it back. Toes tuck under, look up, extend the leg, look at the toes. Repeating that about 10 times. Now, another muscle that crosses over the sciatic nerve is called the piriformis. That's in the middle of our butt. So a nice way to stretch that still keeps room for your belly is you're going to lift one foot over top of your knee while you're sitting. And then, assuming there's enough room with the baby, you're just going to hinge forward. And you might find it doesn't take much. Like I'm already feeling a stretch in my hip. And you can also do this lying down, but I find when we're pregnant, it's a little bit easier to do it sitting. And again, do both sides, crossing the ankle above the knee. Don't put too much downward pressure on the knee, just enough that we start to feel that hip opening and a little bit of a stretch through the back of our hip. Hold that stretch for at least 30 seconds. Now, if you're finding that sciatica isn't going away, that tightness in your middle back is still there, or that pinching in the low back, then you can book in to see us. Both myself and Dr. Jody Freedman are comfortable working with pregnant patients. To book online with us, you can go to willowbrookchiropractic.com. We post regular content on YouTube, Instagram, and Facebook under Willowbrook Chiropractic. If you have any questions about what I've talked about here today, please feel free to ask myself, Dr. Robin Armstrong, or Dr. Jody Freedman. We're always happy to help.